I'm Darnella Melanson, your elected councilwoman and appointed emergency management liaison. In this message, you will be hearing from the members of the Tribal Council and the tribe's emergency management and COVID-19 mitigation team regarding updates related to COVID-19. Due to a recent positive test within our community, we will be providing you with a brief overview on personal protection equipment, also known as PPE. We thank you for your understanding and patience as we reinforce our safety mechanisms and work to improve and promote inclusion with you, our community, and continue to monitor threats to our community, our health, our safety, and wellness. Be well, and thank you.
Good afternoon, and thank you for joining us. My name is Amber Espino. I am the Human Resources Director of the Quechan Indian Tribe and a member of the Emergency Management Team. As part of our mitigating efforts, our role as the Human Resources Department is to maintain a safe workplace for all employees of the Quechan Indian Tribe. During the peak of the COVID-19 pandemic, the coronavirus has changed the way we work and how we operate as a tribal government. As a result of the COVID-19 pandemic, our employees have faced some of the toughest workplace challenges. In managing this crisis, as the employer, a COVID-19 reopening plan has been developed on July 23, 2020 for our employees of the Quechan Indian Tribe and how we as an employer react, respond, and communicate to our employees in accordance with the CDC and OSHA guidelines. In addition to our guidelines, preventative measures have been implemented within our workforce to reduce the spread of COVID-19 for the personal safety of our employees. These preventative measures include PPE and upgraded features in personal workspaces and enhanced cleaning and sanitation of all tribal departments. In addition to our guidelines and preventative measures, our Human Resource Department has partnered with the Fort Yuma Healthcare Clinic to offer our employees COVID-19 testings in the event of COVID-19 symptoms or a COVID-19 exposure. In addition to our COVID-19 testings, as part of our effort to reduce the spread of COVID-19, our Human Resources Department offers resources to help our employees obtain a COVID-19 vaccination. In closing, this is a profound time for our tribal operations, but it's equally important to demonstrate that we as an employer are taking affirmative actions to prevent the spread of COVID-19 within our workforce, and we hope that our employees and their families remain safe and healthy during this difficult time. On behalf of the Human Resources Department, we want to thank our employees for your continued support by promoting a safe and healthy workplace.
Hello, I'm Councilman Jonathan Quechan. I will be going over some of the major changes you may have already seen within our tribal community. I am pleased to announce that we have a COVID-19 disinfectant team that sanitizes our tribal departments as a preventative measure to the spread of COVID-19 and an immediate response to possible exposures. People Market has been relocated and expanded to include a larger variety of items. The new store is approximately 2,800 square feet and has been designated to become a potential distribution site for the community in the event of closures. Sleepy Hollow RV Park isolation area is opening soon. The west side of the park will operate as an isolation area for those affected by COVID-19 and seeking assistance. The isolation area has 18 RVs available for individuals and families needing to isolate. A mini mart is under construction as well. The Andrade parking lot is in the process of installing parking booths with ticket-activated arms to ensure minimal contact between patrons and staff. The parking lot operates with the Alcadones Port of Entry, which is currently open, from 6 a.m. to 2 p.m. with overnight parking available. As you may have noticed, the Parks and Recreation Department has new LED signage and is under construction of much-needed rehabilitation of the showers and bathrooms, as well as staging for a potential congregate shelter. All tribal buildings have been upgraded to include preventative measures such as air scrubbers, which clean the air while the system is running, plexiglass shields, Dutch doors, replacement of carpeting to tile, removal of cloth furniture, and other recommendations by Ms. Robin Waco, Taro/Safety Officer, and Jillian Attaway, Interim Emergency Management Director.
Hello, my name is Jillian Attaway from the Quechan Department of Emergency Management. I'm here today to talk to you about a few things that may help you prevent the spread of COVID-19 to yourself and your loved ones. COVID-19 has changed and mutated over the last year and a half. Here's the most updated guidance and recommendations or recommended actions from serious to less common symptoms. Serious symptoms requiring immediate medical care are shortness of breath, difficulty breathing, loss of speech, mobility, and/or confusion, and chest pains. Please call your healthcare provider to seek medical care immediately. Most common symptoms are fever, cough, tiredness, and loss of taste or smell. Please contact your healthcare provider to obtain testing for COVID. Less common symptoms are sore throat, headache, aches and pains, diarrhea, a rash on the skin or discoloration of fingers or toes, and red or irritated eyes. Please remember to not go out in public if you feel ill and to always contact your healthcare provider for medical advice. Many patients with COVID-19 have low oxygen levels even when they are feeling well. Low oxygen levels can be an early warning sign that medical intervention is needed. Pulse oximeters are a great tool to measure your blood oxygen levels and were made available to tribal membership this past year. A person with suspected or confirmed COVID-19 should reach out for medical advice from their healthcare provider or Fort Yuma IHS at 760-520-4711. For after hours, please call the nurse advice line at 866-896-1585. How do you measure oxygen saturation? Follow the manufacturing instructions for cleaning and disinfecting the pulse oximeter. Turn the unit on with the power button. If it does not turn on, check the batteries. Place a finger in the unit and wait for the number to display. In addition to the oxygen saturation level, the unit may display heart rate and the waveform of the pulse. This is helpful because the more distinct pulse waves indicate better measurement quality. Some factors that can make it difficult for the unit to be read are dark colored nail polish, cold fingers or poor circulation, tremor or movement, too much pressure on the probe. Please monitor your blood oxygen levels regularly and contact your healthcare provider for medical advice. The emergency management team also encourages you to make the right choice to wear a mask. Please wear a mask in public to help prevent the spread of COVID-19, including the Delta variant, even if you are fully vaccinated. You are at highest risk of exposure without one. Masks help prevent the spread of COVID. You are at moderate risk for exposure when out in public masked. Make sure you make your mask fit snugly and comfortably over your mouth and nose. Practice social distancing and encourage others to wear a mask around you. You are at low risk for exposure when everyone is wearing a mask and 6 feet apart. Remember to avoid touching your mask and to wash your hands after removing it. Thank you for helping to stop the spread, and remember to stay safe by choosing healthy habits.
Hello, my fellow Quechans. I am Virgil Smith, Vice President of the Quechan Indian Tribe. You've heard from the team on some of the mitigation efforts by the tribe to minimize the spread of COVID-19 with our employees and now with you, the community. We continue to ask that you keep sanitizing and maintain social distancing. We also encourage to be vaccinated. You can call IHS at 760-520-4711 to schedule an appointment to be vaccinated. It is all of our responsibility to stop the spread of this virus. Thank you and stay safe.